Hi, did you know that it's very important to release our patients from the hospital with a prescription for the guideline-directed medical therapy in order to improve their survival? My name is Dr. Rachel Dankner. I work at the Gertner Epidemiology Research Institute at the Sheba Medical Center in Israel, and I would like to tell you about the paper published in the Mayo Clinic Proceedings titled Emulated Trial for Discharge Prescription of Guideline-Directed Medical Therapy and 15 Years Survival After Coronary Artery Bypass Graft Surgery. This is an emulated trial based on a prospective cohort study where we gathered data on CABG patients from 7 cardiothoracic units spread throughout the country of Israel. So we have a representative sample of CABG patients, and they received CABG surgery during January 1st, 2004 till December 31st, 2007. We followed them up until the end of 2020 for all-cause mortality. Our statistical approach was a Cox regression model with propensity score adjusted inverse probability of treatment weighting, which allowed us to reveal a lower mortality in those patients exposed to the discharge GDMT prescription as compared to those without this prescription. So our main findings in this paper were that only 60% of CABG patients were discharged on full guideline-directed medical therapy, GDMT, after CABG surgery. We defined guideline-directed medical therapy as aggregated antiplatelet agents, statins, and beta blockers. In addition, admission GDMT use conferred 7 times greater likelihood of discharge GDMT prescription with an odds ratio of 7.1. Finally, we found lower 14-year mortality in those patients discharged on GDMT as compared to those discharged on partial or no GDMT. Now, through the emulation, we were able to create 2 identical groups of exposure to GDMT and non-exposure to GDMT. So as you can see in this Kaplan-Meier survival curve, the survival of patients on full GDMT is better than those patients on partial or no GDMT. And you can see here the Cox proportional hazard regression model, adjusted regression model, showing that their survival is 25% better with a significant confidence interval. So how does this finding relate to clinical practice? Physicians should remember that the patient is looking up to them to make their choices and to help them make their choices. But also physicians in the community look up to the physicians in the hospital, and sometimes they may assume that the discharge of patients from the hospital is the final call in terms of the recommended prescription or the recommended medication for the patient. And they should not assume that. We should all make sure to use the GDMT and to prescribe them to the patient, to our patients, in order to improve their prognosis and their survival. Finally, I invite you to read the full paper at the Mayo Clinic Proceedings. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.